Hello everyone, my name is Nimra Badr and I am one of the internal medicine residents here at the University of Oklahoma Health Sciences Center. And I am excited to present this visual abstract of my project with everybody. So let's begin. My project focused on what are the factors that are associated with difficulty maintaining insufflation during a colonoscopy. A word on insufflation, it is a technique that is used by the endoscopist to inflate gas. Carbon dioxide is the standard of care. And this, by insufflating the gas, it distends the colon and helps visualize the mucosa, the tissue better. It also allows for safe advancement of the endoscope. So this can, however, cause discomfort for patients, and hence some form of sedation is delivered to help mitigate symptoms. This can be either moderate sedation with fentanyl or diphenhydramine or Versed, midazolam, or this can be monitored anesthesia care, MAC, in which propofol will be used to give sedation. So our hypothesis was that for people who have deeper levels of sedation, such as with propofol, MAC sedation, they would have more difficulty maintaining insufflation. And that was what we set about to find out. So we did a prospective study at the VA Medical Center here in Oklahoma City and we recorded data on all colonoscopies that occurred between November 2019 to March 2020. We recorded basic demographic data from the EMR of the patient details. We also went through the endoscopy procedure notes to see the length of the procedure and what types of anesthetics were delivered. And finally, we recorded questionnaires that were filled out by the endoscopist post-procedure that recorded whether there was difficulty maintaining insufflation in their view and what endoscopic maneuvers were used. We then analyzed the data, and we had a total of 542 participants, out of which we excluded 12. And of the remaining ones, we found that over 1/4 of the procedures of the colonoscopies were reported to have difficulty maintaining insufflation. The total number was 129. When we compared the two groups, we found that 4 factors were significant for difficulty maintaining insufflation as per the odds ratio. So those results have been compiled in the center of this slide. And as you can see, age was one of the factors that was noted to be significant. And the second one was MAC sedation that had, as we had hypothesized previously, had been noted to have a significant relationship or association between the two. And lastly, total procedure time or increased length of procedure and fellow involvement with the procedure was also noted to be having an association between difficulty maintaining insufflation. We did a literature review before doing the study, and obviously we can explain that with age, as with older adults, one study we found mentioned decreased anal sphincter tone in older adults, and this may explain why there was difficulty maintaining insufflation in this patient population. As for MAC sedation, we did find a study that focused on using propofol and measuring the anal sphincter tone, and it was indeed decreased in that setting. So this can also explain why there was increased difficulty maintaining insufflation. We think that this study was significant because insufflation is an important part of the procedure, and this allows for a safe and efficient colonoscopy. It allows for better identification of the tissue by the endoscopist. So if these 4 factors can be studied in the future, it would be something worth exploring on. And finally, to our knowledge, no other studies have explored a relationship with difficulty maintaining insufflation or what other factors are involved specifically during a colonoscopy procedure. And so thank you so much. I will end my presentation at this point. And these are some of the references I found that could possibly explain the difference that we found on the 4 factors associated with difficulty maintaining insufflation. And I have included my email address on the bottom if there are any questions. Once again, thank you so much for your time. Have a great day.